Hello, viewer, and this is Dr. Ashok Mehta. First of all, I take this opportunity to thank everybody for supporting my YouTube channel. I was very surprised that in such a short period of time, I was able to accumulate a lot of views and a lot of interest from general public. So I want to thank you all for that, which encouraged me to further present some of the important healthcare topic we deal with on a daily basis. And I thought it might be a good idea for me to um, talk about this thing in person. Uh, without much further ado, today I'm going to talk about a routine test we have started doing last year, somewhere in April. This is a advanced lipoprotein profile, or what we call as a lipid profile, which is able to give you a lot more detailed information. And I get this request from a lot of patients as to how to interpret the new NMR lipoprotein profile test. Now, the NMR part stands for nuclear magnetic resonance lipoprotein profile. Now, before I jump into interpretation of the this particular test, I want to briefly discuss what a lipoprotein is and why it is so important. I'm pretty sure that almost all of you had a lipid panel done, and they talked about good, bad, cholesterol. But so today I'm going to talk about what is the meaning of all that and why this topic is so important to everybody. So, lipoprotein are the type of protein which basically transport or actually carry the fat or the cholesterol from your intestine to the bloodstream, and then it goes to the liver, and in the liver it is processed and sent to different parts of the body, where it can be used to make different kind of hormones and other chemicals, the cell walls, and there are so many other things. In fact, for the benefit of viewers, I would like to mention that about 20% of the lipids are used yeah, in the building of the cell wall, and which can become very important in different parts of the body. The largest of the lipid or lipoprotein is called as chylomicron. These are the least dense particles, and basically the origin of that is in the intestine when the lipids are picked up, or cholesterol actually is picked up by the cells, and it become a chylomicron. Now, the next in line is called as a particle by the name of VLDL, or very low density lipoprotein. These particles are created by or produced by a liver and contain high amount of triglyceride. And triglyceride being a small particle, it tend to make this cholesterol low density. Um, as the VLDL lose the triglyceride once they go to different part of the body. Triglycerides are used by certain cells, and then what is left is called as low density lipoprotein, or LDL cholesterol, which has less amount of triglyceride. And this is the cholesterol LDL, which when it is oxidized can become dangerous in creating what we call as a cardiovascular disease. The third or the fourth type of cholesterol is called as high density lipoprotein, and these are the particles which basically are used to clean up um, the blood from the bad cholesterol. So actually, these are the good particle. So I'm going to briefly mention here the importance of um, the oxidized version of LDL, or we call it the ox LDL. Um, and ox LDL is extremely important. And one may ask, what is the ox LDL? Why it become critical in creating coronary artery disease? The ox LDL are the particle of LDL cholesterol which are oxidized, which further reduces the size of the LDL particle. And when they become smaller than certain size, these LDL particles are able to enter into the cell, and um, it, these are able to create a plaque. Because these particles are oxidized, they are inflammatory in nature, and because of the inflammation, it creates an environment which promote production of the plaque, which later on, when become bigger, can cause a heart attack. So, without much further ado, I would like to um, talk about the interpretation of NMR lipo, and I would like to share this thing with you in just a brief second.